Last 2 years, so it's a pleasure to be back. I have no disclosures. Since I'm the first talk of the day, I thought that I would level set a little bit and talk about some cancer statistics just so we all kind of are primed for the rest of our day. There will be about 1.7 million cases of cancer in the US diagnosed this year. There's a typo in your handout, but that's 2018 statistics. There will be about 600,000 deaths. If we look at estimated new cancer cases in the US, breast cancer continues to be the #1 diagnosis for women, about 266,000 cases. For men, it's still prostate cancer. But what I want to point out here is that that number of prostate cancer diagnoses has gone down precipitously. That same graph 5 years ago showed prostate cancer at 238,000 cases, and 3 years ago, 220,000 cases. So that number has gone down because of screening guidelines. So we all know that screening in prostate cancer has been a big issue, big area of controversy, and we're seeing the effects of that now. So what does that mean for you as medical oncologists? It means that you're going to see more advanced cases in your clinic. Lung cancer continues to be the #1 cancer killer in the US by far. So you need to tell your patients to stop smoking. It's a public health issue. 15% of women in the US still smoke. 20% of men in the US still smoke. So this is a public health issue and a real tragedy that lung cancer continues to be such a level of cancer killer in the US. I have some statistics around smoking in your handout. I will move on from there. You can look that in your handout, but genital-urinary cancers will be our focus now. Prostate cancer we talked about. Again, I'll just comment that it's really interesting to see how public health initiatives really play out in these statistics. So what I think will happen is that, again, there'll be less and less of these early cases diagnosed. Some people would argue less and less clinically insignificant cases of prostate cancer. But again, what I think you'll see in your practice coming up is because men are not being screened as often for prostate cancer, there'll be more initial diagnoses of metastatic disease and land up in your clinics. Kidney and bladder are sort of middling, 60 to 70,000.